So at your office, you do this teeth in a day, where people without teeth or dentures can walk in and same day walk out with teeth. Tell me about that.
Yeah, it's totally changed. You know, traditionally, we'd have to take the teeth out, let the gums heal. Then we go back and place the implants. We'd wait another 6 or 8 months, 9 months. Then we'd go back in and place the teeth. Now we can take the teeth out the same day, or if they're missing teeth already, place the implants the same day, put teeth on it the same day, and the patient walks out with teeth that are attached to the implants in one day.
How soon can they eat with that?
They can eat that day. That day they can eat, and they can smile, they can feel great.
So this same day approach, this is not how it's normally done. Right? I mean, I've had doctors on the show that say they're getting implants. It takes about 9 months.
Yeah, and that's kind of an older way of thinking. You know, there's a lot of research that have showed that we can do this, and we're doing this all the time now. It's become a routine thing to where we give our patients teeth in a day. They can eat whatever they want, and it's changing lives.
So you're lecturing. I mean, when you lecture on the road to other dentists, or you're at USC on faculty there, this is what you're teaching, this whole same-day concept.
Yeah, we're teaching them how to do this predictably, how to design the smile with the artistic little aspects that it follows the lower lip and it matches the face. And this is what changes people's lives. This is why I do what I do.